Hello guys, how are you? So I'm going to present on adrenaline drug. Adrenaline is a hormone derived from tyrosine, which is an amino acid. It can also be spelled as adrenaline without an E in some countries, and it is classified as catecholamines. So adrenaline is a methyl group attached to its nitrogen, also have a hydrogen atom attached to its nitrogen. So we're going to see the structural formula of adrenaline in the following slide after this one. So adrenaline drug is also known as epinephrine, and adrenaline contains 1 milligram per ml of epinephrine, and as you can also see, we can see that adrenaline is a colorless drug. Moving on, this is the structural formula of adrenaline and the molecular formula. You can also see the molecular formula to your left. So moving on to the pharmacology. Adrenaline drug belongs to a class of drugs called sympathomimetic agents. It is used for emergency treatment of severe allergic reactions, anaphylaxis, which is an allergic reaction that can occur within seconds or minutes of exposure to an allergen, and if it is not treated right away, it can result in unconsciousness. It is also used for emergency treatment of cardiac arrest, local anesthesia, hypotension caused by septic shock, acute asthma attacks, distribution of blood to the muscles, and also improving hearing and other senses such as sight by enlarging the pupil of the eye. Moving on to the mechanism of action. Adrenaline is an alpha and beta adrenergic agonist which exerts its therapeutic actions through predominant beta and also alpha receptor agonistic actions. So there is beta 1 receptor which increase heart rate, contractility and excitability. So adrenaline is useful in cardiac arrest, where it causes the redistribution of blood flow to the heart and helping restore heart rhythm. Beta 2 receptors, their mechanism of action is bronchodilation, suppression of the release of inflammatory mediators. Bronchodilation is when muscles relax in the lungs and widen the airways to make breathing easier, so that patients remain conscious. Alpha 1 receptors, vasoconstriction of blood vessels supplying skin and mucosa. Alpha 2 receptors inhibits insulin release, induces pancreatic glucagon release. So the beta 2 reverses the effects of anaphylaxis, and also agonism at beta 2 receptors leads to bronchodilation, which is the relaxation and widening of the lungs to make breathing easier, and suppression of inflammatory mediator release from mast cells, reducing inflammation and promoting bronchodilation. So the routes of administration are intramuscular, In intramuscular, adrenaline is injected intramuscularly or subcutaneously into the anterolateral aspect of the thigh or through clothing if necessary. Intravenous, intracardiac, and also in an emergency, the fastest method of administration is necessary. For example, intravenous form and an intravenous solution can also be used. So this is intramuscular. Intramuscular aspect of the thigh through clothing and directly into the skin. Then intravenous, intracardiac. So moving on to the side effects of adrenaline. It causes the skin to be pale, it causes headache, sweating, patients feel weak, dizzy, tachycardia, anxiety, and also vomiting. So the skin becomes pale as blood vessels receive a signal to divert blood to areas more in need of oxygen. And these side effects only last for about an hour. How adrenaline is used in radiography. During procedures such as CT angiogram, there is a risk of anaphylactic reactions for patients receiving the contrast agent administration. In case that a patient has an allergic reaction to a contrast agent, adrenaline drug is used to treat the allergic reaction, and it is administered into the anterolateral aspect of the thigh every 5 to 10 minutes if necessary. So radiographers and other healthcare professionals who administer medicines, including contrast media, should be trained and confident to recognize and manage such a reaction. Thank you so much.